Just over 2% of adults in the United States have autism spectrum disorder, and that translates into more than 5.4 million people.
And with Texas being among one of the states with the greatest estimated number of adults with ASD, doctors at UTHealth Houston started a program specifically for young adult Latinos. We are joined by Dr. Antonio Pagán from UTHealth Houston to learn more about this program. Doctor, thank you for being here.
Yeah, thank you so much for having me.
Okay, we're going to talk about the program in just a bit, but we were having this conversation about, why specifically for Latinos, especially here in the Houston area, for Latinos that are living with autism.
Yeah, absolutely. So one of the things that we find in the scientific community is when we develop something, we often will develop it for the majority population. But that might not include the values that are important to Latinos. And then the other part is shared language. So we sought to, with the help of our donors, Autism Speaks, to culturally adapt and translate the program to meet the needs of more than 50% of Houstons, that includes Latinos.
So the program is called Iniciando, Adultez. So getting started, adulthood.
Yeah.
What did you say? Launching into
Launching to adulthood is the English version, and that's the Spanish version.
So
exactly.
how does this program work exactly?
There's a lot of facets to it. Every time we meet with families, we're actually iteratively changing it to match their needs. So they tell us, hey, we want to add more social opportunities for these young adults. Awesome, we'll do that. We've added webinars where young adults can meet with individuals from the community who are experts, who know much more than me and can provide more information. And then we also have group therapy and individual therapy. One of the awesome parts about it is we've made it hybrid. So we meet in person for the first, middle, and last session, and then online to allow for those who are, Houston is so spread apart, that allows us to still meet together.
You said families that maybe come to Houston as teenagers, as adults.
Yep.
Do they typically find out the diagnosis once they come here? And if so, would therapies in adulthood benefit them as well?
Absolutely, yeah. There's always something that we can do to help. Typically, obviously, we're not trying to cure autism, and we view autism from a neurodiversity perspective. So we view it as a different way of looking at life. It's kind of like me having brown eyes versus green eyes, right? That doesn't make us better or worse, it just makes us different. And they look at the world in a different way. What we want to help with is co-occurring issues like anxiety, depression, ADHD, stress. We want to help reduce those issues so that they're able to function well in adulthood.
So for some, do you call them clients, patients, the folks that you work with? Is there an ideal age? Because eventually we all transition into adulthood. We're just talking about those specifically with ASD and in the Latino community.
Yeah, exactly. So our program was designed for those between the ages of 18 to 25. The reason why is that when you graduate high school, there's a significant service cliff, right? You lose services. More than 60% of individuals with autism are under or not at all employed. And so we want to help them gain employment, gain skills that they might need, and then also enter into post-secondary education if they want it. So that, time range between 18 to 25 is super important.
Yeah. So if people are watching, how can they get involved? How can they become a part of this program or this change that's happening now? Yeah,
absolutely. I think the first is if you do know somebody who might be interested in the program, you can search Launching to Adulthood Houston, and you can find information for our program on our McGovern Medical Center website. And then the other part is just supporting the community, telling others who might benefit from it. We're also adapting it for the military population. We're trying to reach their needs, given how often they're moving and how they might not have access to resources during this transition period. So really, we're just trying to expand and learn from those who are in need.
It sounds like you're really able to customize this response in a way that maybe hasn't been done traditionally.
Absolutely. So we take a community-based participatory research approach where we adapt our program to meet the needs of the community. So we ask them, what do you need, rather than telling them what they need.
Right.
What would you find here in Houston specifically? Is there something that stands out, maybe that's different?
I think just the culture, obviously, that we've talked about, the language, the family is really important. Making sure that everybody is involved is a big part of what we've done. In fact, a lot of our parents have said they feel like they have gained a family by participating in the program. So we're really grateful for that as well.
Interesting. Yeah, you can only sort of imagine an immigrant family coming here not speaking the language, feeling very much alone. And then you add on top of it this diagnosis that maybe they don't understand?
Yep, and I think the other part is the parents. I've been just blown away. They care so much about their young adults. They spend hours a day looking for resources for them, and being able to partner with them rather than telling them what to do has been just an incredible experience as well.
Yeah.
That's great.
Dr. Antonio Pagán with UTHealth, thank you so much for being here with us.
Thank you for having me.
Can you tell us that website one more time.
Launching to Adulthood Houston, and it's on the McGovern Medical School website.
Okay,
Perfect.
beautiful.
Thank you, Doctor.
Thanks, Doc.
Thank you so much.